guys, welcome back to DOCSHAALA, and in this video we are going to see about internal resorption from the subject oral radiology. Okay, so that was a question which was asked in the previous NEET MDS exam. So let's see what is that. So what is a resorption? So resorption is defined as a condition associated with either physiologic or a pathologic process resulting in loss of dentin, cementum or bone. Okay, so there is a loss of dentin, cementum or bone. So resorption is said to occur with this. So Anderson has classified resorption into two types, that is internal and external. So internal is inflammatory and replacement. External is surface, inflammatory and a replacement. So let's see what this means. Okay. So what is an internal resorption? So as you can see in the image here, there is inflammatory resorption here, right? Or a replacement or metaplastic resorption. So this is the difference between inflammation and replacement. Okay. So internal root resorption is the progressive destruction of the intraradicular dentin and dentinal tubules along the middle and apical thirds of the canal walls as a result of clastic activities. Okay, you have to remember this. It is the destruction of intraradicular dentin along with the dentinal tubules along the middle and apical thirds of the canal walls. So as a result of clastic activities. Then what is the etiology involved behind it? It may be due to traumatic injury, infection or orthodontic treatment. Then so the resorption occurs in two stages. Okay, so there is we have to see how it occurs, right? How it is going. So there is degradation of the inorganic mineral structure followed by disintegration of organic matrix. So there is degradation of inorganic mineral structure followed by disintegration of organic matrix. So internal inflammatory resorption involves progressive loss of dentin, whereas root canal replacement resorption involves subsequent deposition of hard tissue that resembles bone or cementum but not dentin. Okay, inflammation involves loss of dentin. Okay, dentin is lost in inflammatory resorption, whereas replacement type of resorption involves replacement of the dentinal tissue with bone or cementum. So this is very important. You have to keep this in mind. Okay. So internal inflammatory resorption can be perforating or non-perforating root resorption. Okay. So this is how a tooth with resorption, internal resorption looks like. So the clinical features are, it is usually asymptomatic and it may include presence of a reddish area, pink spot as you can see in the image. So which represents the granulation tissue showing through the resorbed area. So the granulation tissue which is formed due to inflammation over there is being showed through the resorbed area. Then the radiographic features which involve this are, radiographs are mandatory for diagnosing the internal resorption, which reveals round to oval radiolucent enlargement of the pulp space. So as you can see in this image, so here is the lesion as we can see through the naked eye. When we are taking the radiographs, we can observe the inflammation, right, in various angles. Okay, and this also you can see here, right? So the margins are smooth and clearly defined with distortion of original root canal outline, helping to rule out external resorption. Okay. Then the diagnosis involves visual examination based on change in color of the tooth crown, that is reddish pink spot. Okay. Then radiographic diagnosis, as we have seen, conventional cone beam CT and light microscopy and electron microscopy may also be used. Then coming to the treatment. Treatment involves, of course, we have to remove the inflammation and fill it with any of the root canal materials like MDA, glass ionomer cement, super EBA, hydrophilic plastic polymer, zinc oxide, eugenol, zinc acetate, cement, amalgam alloy, composite resin, and thermoplasticide gutta-percha. So we can use any of them either by injecting it or condensation techniques. Okay. So the question that was asked in NEET MDS 2022 was, so this image was given. So as you can see, the lesion is, we can appreciate it in the apical third. So the question was a clinical question. So a patient reported to the clinic with a chief complaint of pain in the upper front tooth, gives history of trauma 6 years ago. So there is a history of trauma. Then clinically no significant findings were seen. Radiographic image of tooth is attached. Identify the condition. So since the tooth has undergone the trauma, we can easily identify it as a traumatic lesion, right? So the options given were internal resorption, dens indenti, external resorption, dens invaginatus. So dens indenti and dens invaginatus doesn't look like this on a radiograph, and of course external resorption does not look like this on a radiograph, because giving a radiograph itself, it suggests that there is no external resorption. So the answer is the internal resorption. Okay. If you like our video, do like, share and subscribe to our YouTube channel. You can also follow us on our Instagram handles at DOCSHAALA for dental content and at DOCSHAALA medical for medical content. You can also find us on Telegram. Thank you.